For the woman, the O-Shot isn't just for libido, although it is, and there's many, many, many women who can't orgasm, maybe never even have orgasm. So it would definitely help that. But a lot of women's sexual dysfunction is because it hurts, it's painful, or there's vaginal dryness. This O-Shot helps relieve that. In addition, women have a lot of problems with urinary incontinence, especially as they get older. And 95% of urinary incontinence can be improved or completely cleared up with the O-Shot. So it's a tremendous tool for helping women who have problems in the vaginal area. Men, the P-Shot, like I said, there's a lot of medical reasons why a man may not be able to have a good erection, and it could be because you need a good blood supply. So if you have high blood pressure, if you have diabetes, if you have vascular disease of other kinds, if you've had a prostatectomy where the nerves have been cut and damaged, then you have that problem. But the P-Shot can help rejuvenate those tissues and get the function back for these men. What I do for O-Shot and P-Shot, we're using what's called platelet-rich plasma. And there are no side effects with this because you're using your own blood products. What I do is I use a 60 cc syringe. I draw 60 cc's of your own blood. I put it in this machine, which is called a centrifuge. And I put the blood in here, put it in the machine, spin it down, centrifuge it, and when it's done, I have red cells. 40% of that is red cells on the bottom, and the other 60% of that is the clearer plasma on top. I pull off the plasma, put it in another tube, centrifuge it again, and what goes to the bottom are the heavy platelets with platelet-rich plasma on the bottom, maybe about 8 cc's out of all of that 60 cc's that I had. And I use that to inject back into the penile tissue or the vaginal tissue. And by doing that, it's very, very rich. Platelets are very rich in growth factors. And these growth factors send out signals to form new cells, new collagen, new blood vessels, new nerves, all the kinds of tissue that is necessary in that particular tissue that I've injected. So you get a rejuvenation. It takes a couple of weeks for that to really start working, and then it works over several months. Most people don't even may never need a repeat shot, but some may need or want to have another shot in 6 months or a year, just depending on their response to this. But we get great benefits, and there's ongoing research for all kinds of conditions for the O-Shot and P-Shot with platelet-rich plasma. When I do the O-Shot or the P-Shot, it's virtually painless. I have a cream topical anesthetic that I put on the tissue. We wait 20 minutes, we get it good and numb, then use a tiny little needle to inject the PRP, a couple cc's in each of several spaces, and you don't feel anything. There's no downtime, there's no recovery time, there's no bleeding. You're up and moving and going immediately. So this is a very painless, effortless on your part procedure to do with great effects.